Welcome back to Preserve Health Talks. I'm your host, Dr. Ira Perlstein, and we have with us today Lois Cassle. Again, welcome, Lois.
Thank you.
Welcome back to Preserve Health Talks. And for those who might not have caught your previous episodes, could you briefly just reintroduce yourself and tell us a bit about your company, Elite Health and Wellness, and what you do?
So I am Lois Cassle. I am an autonomous nurse practitioner, board certified family nurse practitioner. And I own Elite Health and Wellness Center, and we do concierge primary care from a functional medicine perspective, as well as hormone replacement therapy, medical weight loss, and some facial aesthetics.
Now, I know recently, though, you've gotten into something new, which is what I want to talk about today, and it's peptides.
Yes.
Peptides are pretty cool, and people really don't know what peptides are. And before you explain that, I just want to tell everyone, even though you don't think you've heard of peptides, you have heard of peptides, because people are asking me all the time for weight loss drugs and semaglutide and tirzepatide. These are peptides.
Yes.
Insulin
Exactly
is a
what I was gonna
peptide.
say.
And so we make peptides in our body, and peptides are just very short chain groups of amino acids, is my understanding.
Correct.
And they act as signals. They tell things in the body to turn off and turn off for hormone regulation, for healing, for rejuvenation. And we can actually augment these peptides with man-made peptides, I guess, or some, lab-made peptides,
Yes.
and augment them and give them to people to help regulate body functions. So how did you get into peptide management in your practice, and what piqued your interest?
So in a quest to, with complicated patients who don't respond to conventional medicine, we were looking for ways to augment their therapies and get them better results. And the peptides have really been very, very helpful with that.
Okay, so, they influence healing, they influence metabolism,
Immune modulation.
and cellular repair,
Yes.
right? Okay, so that's what they do in simple terms, but let's talk more about the clinical applications. Someone comes to you and says, I've heard about peptides. Am I a candidate for peptides? Who's a candidate for peptide treatment?
Well, anybody can be a candidate for peptide treatment. It depends on what their goals are and what their issues are, what peptide that would be appropriate for them.
All right, so someone comes to you, they're aging, they're fatigued, they say, I don't heal well, I find myself getting sick more often, I'm visiting Dr. Perlstein because I need medication. Now they're seeing you, in addition to me, and they go, can you help me with peptides? And what would you do?
So if their primary concern was that they're getting sick too often,
Okay.
the peptide that we use for this is thymosin alpha-1. Thymosin alpha-1 is an immune modulator. So if you have low immunity and you get sick frequently, or if I take it myself, if I'm about to go on a cruise or go on an airplane, it boosts your immunity. But for people with overactive immune systems, even with autoimmune disease, it downregulates that immune response, and it helps with autoimmune disease as well. So thymosin alpha-1 would be a peptide, and what we do is we would teach the patient how to self-administer that.
All these peptides injectable?
Not all of them, but most of them are.
I know peptides generally, unless they're injected, have poor absorption.
Yes.
So, but there are some intranasal peptides out there?
There are. So my experience with them is there are more side effects with the intranasal ones, like headaches and nausea. But there are also, BPC 157 is a peptide that's used for tissue repair, but it's also used for gut health. And that can be taken in an oral form very effectively.
So our audience is going to want to know, how often do people need peptide treatment? So if it's like semaglutide for weight loss, that's a weekly peptide.
Yes.
But something like an immune regulator or for tissue health, how often are you administering these peptides?
So with these peptides, we cycle them first of all. So thymosin alpha 1, for instance, is a twice a week injection. And they do that for approximately 10 weeks, and then they cycle off of it. And then they don't use it again until if they need it again.
And they can self-inject.
Yes, it's a subcutaneous insulin syringe type injection.
Now, how are these peptides regulated by the Food and Drug Administration? Does the FDA approve all of these peptides, or some of them still in clinical trials? Or what are you doing in your office?
So even the ones that are FDA approved are sometimes used off-label. So, for instance, Cimarelin.
And define for our audience off-label.
So we're using it not for what it's actually FDA approved for, but we have evidence to show that it works for other things.
As an example, guys, Ozempic is a diabetic medication.
Correct.
Most people are on it now for weight loss. That's it was at one time an off-label
Right,
indication.
but then
Now
it got
it's
an
got the
FDA
indication.
approval under a different name of Wegovy. But all of it is really semaglutide, which you can also get in a compounded version.
Okay, so back to the off-labeling.
So, Cimarelin, growth hormone stimulators. There's several of them that have FDA approvals. Cimarelin is for short stature in children. It is FDA approved. Tesamorelin is approved for HIV patients for dyslipidemia.
And the reason for that, guys, is that most HIV drugs adversely affect cholesterol profiles. And so you can take someone who's being treated for HIV and their cholesterol can soar into the 400s because of the antiretroviral. So how would this counteract that?
So they also accumulate fat in their abdominal area more than non-HIV patients. But anyway, they have FDA approval for that. But what we would use them for is to help people with sleep, help them with better results in the gym. It improves their overall metabolism. The growth hormone stimulator that we use is CJC with ipamorelin. We don't use tesamorelin because it's extremely expensive. Most things that are FDA approved are financially out of reach for off-label use. So
let's talk about cost. I'm feeling fatigued. I want to come to you, and you recommend some peptide treatment for me. What's going to be my out-of-pocket cost? Because certainly insurance isn't going to cover any of this.
Right. So for about a 10-week supply of the CJC ipamorelin, it would be around $300. Most of the peptides sort of range in that price range. And that would last you about 10 weeks.
Now, I know there's been some controversy on the purity of a lot of these peptides. They're compounded.
Yes.
And they're usually compounded by compounding pharmacies. And where are you getting your peptides from? U.S. manufacturer, overseas? How is that regulated at all?
So all of our peptides come from U.S. 503A pharmacies. And we're very selective of what pharmacies we use.
And what's a 503A pharmacy?
So there's two kinds of, there's 503A, it means that it has to be patient specific.
Okay.
We cannot order an office supply of CJC ipamorelin or any of these. We have to order it specifically for each patient. And then the pharmacies that we use give us a certificate of analysis on every single thing that we order from them. And that way we're assured of the quality and the purity of what our patients are injecting.
So what should patients and myself as a clinician be cautious about if I'm sending someone for peptide treatment?
So some of these research laboratories that people can go to online are dangerous. Because it says, right, they disclaim everything they do, and it says not for human use. But their costs are cheaper, and they don't require prescriptions. So nobody has to oversee that, and people can get their hands on peptides, and they can cause some serious downstream problems
Such as?
by injecting hormones peptides that are not pure. Well, they could not get the desired effects. They could just stimulate reactions that we're not looking for, because these are all messengers, and it's a domino effect, and you have to learn and understand the pathways that these peptides are going to take to, I haven't had any of that happen, because I don't ever alter from the guidelines that we use for the pharmacies that we choose.
And are there any specific contraindications for use of, say, some of these hormones, particularly the ones that stimulate growth?
Yeah, so growth hormones will stimulate growth of everything. So if you had a malignancy, it would also stimulate the growth of that. So we have to be reasonably sure that somebody does not have any form of cancer at all. Even a history of cancer, unless it's a 100% cure. But now thymosin alpha-1 is used with cancer treatments. It's used with sepsis. There's clinical trials going on right now with that in ICUs across the country.
And again, the indications for thymosin alpha-1
is to boost the immunity.
Okay.
So a sepsis patient is the sickest patient that you're ever going to find, and they're finding better outcomes. Now, they're still using it in conjunction with conventional therapies and antibiotics and everything else and pressors, but the outcomes are better and quicker with the thymosin alpha-1 in it. And I know other functional medicine doctors that are using it for patients who refuse chemo, and it is slowing down the growth of their patients' cancers.
So I would imagine that peptides play a large role in functional medicine.
Yes.
Okay. So having said that, are there age contraindications? Is someone ever too old for peptides or too young for peptide therapy?
So again, it really, really depends. We check, so for someone who wants the growth hormone stimulators, we never give anybody actual growth hormone. We give stimulators to stimulate the pituitary gland to pulse out more growth hormone at night when you sleep. So it's approved for use in children, right, for the Semerelin. But if somebody is in their 20s and they come to me and they just are looking to build more muscle and their testosterone levels are adequate, we check a IGF-1, which is the growth hormone, the insulin factor. And if they really don't need it, then we don't give it to them, because if you overstimulate that growth hormone, you can cause other pituitary problems. So
someone who has, let's just say, an underactive pituitary, hypopituitarism, okay? Or let's say they developed it during childbirth, which is a common reason to have an infarct in your pituitary gland and develop panhypopituitarism, okay? Because these are modulating chemicals, then the peptides would be ineffective, I suppose, in that situation, correct? Because it stimulates the pituitary, and now the pituitary is not working.
Well, so the growth hormones the growth hormone stimulators are not really modulators. They are increasing the growth hormone.
Okay, so they don't act on the pituitary.
Thymosin is a modulator.
Okay.
But not the growth hormone.
Okay, so
they would, I would think they would benefit.
But we're checking all those baseline
Yes.
chemicals like your thyroid stimulating hormone,
Yes.
and other your follicular stimulating hormone,
Yes.
luteinizing hormone, all these hormones that are made
Yes.
in the pituitary gland. And if they are down, then we look closer at the pituitary and know that there's a problem there.
Yes.
Okay. Got it. So cutting edge, what's coming around the corner in peptides?
So peptides, I believe, are just the forefront, new frontier in medicine in general. And I do believe that they will get more and more FDA approvals. And hopefully that will make it more accessible and affordable. But I doubt that.
More mainstream, because right now it's kind of on the edge. Some people know about it, some people don't know about it. Of course, everybody knows about Ozempic and Mounjaro because it's all over television, and everyone wants to be thinner, I suppose, and it's an easier way perhaps to lose weight along with modified exercise program and diet. But over the next 5 to 10 years, do you see peptides becoming a little bit more mainstream, perhaps?
As long as we can get more human studies, a lot of these peptides are, the evidence is based off of animal studies. I take these peptides, so I know what they feel like. And just in an observational study way, we see incredible changes in our patients with it. I have had a patient heal a rotator cuff tear with the BPC injectable. Tendons in the foot repair. Somebody after an Achilles tear even uses BPC there. The healing time is a third.
And what do they think the mechanism of action of that is? That it increases internal stem cell production, or?
Angiogenesis.
Okay. You want to explain that?
So angiogenesis means that it increases the blood supply to that area and helps it heal faster.
Okay, got it. For clinicians and patients and just our listeners who want to know more about peptides, where can they begin their education?
So for clinicians, physicians, PAs, and NPs, the Academy for Anti-Aging Medicine, I am trained by them. There is something called the Seeds Institute, and Dr. Seeds is a peptide guru, very published and well known. They offer seminars all over the place, and even World Link Medical is another. Neil Rouzier, I also train under him for hormones, and he also discusses peptides quite a bit. So there's so much information out there. For patients that want to learn more about it, they should go to a provider that can educate them.
Such as yourself?
Yes.
And how would someone get in touch with you?
So our office is on US 1 in Port St. Lucie, just south of Crosstown. Our phone number is 772-777-8233.
Okay, and one last question, and then we'll close out today's show. What's the one message you'd like listeners to take away about peptides and their role in medicine today?
To be open-minded about them, and just to be able to see the benefits and the changes that it can make in your health and wellness.
Okay. Peptides. We're going to re-explore this in the future. This has been another episode of Preserve Health Talks. Thank you for joining us. We'll see you again on our next episode.